we are going to get into how to position the XCP in the patient's mouth. So in this particular video, I'm going to work with the anterior. So we are going to place our sensor and get that lined up. Of course, this is a size 2, so not the most comfortable for those patients in the anterior portion. But what we want to do is, prior to placing this in the patient's mouth, we want to lean and tip. Lean the chair back just a little bit and or tip your patient's chin up to facilitate the placement of the XCP. So something you want to keep in mind is if your patient is leaning down and you're doing a mandibular picture, when you place this film and your patient bites down, now their head's down. If they're wearing a thyroid collar, you're going to capture that in your picture. So this is why we want to make sure that we're moving our patient's head accordingly. So if my patient has a thyroid collar on, I'm actually having them lift their chin up to ensure that I'm able to get the x-ray I'm looking for and not that of a thyroid collar. So little pro tip there for you. So once you have this in place, and like I said, this is size 2, so a little bit larger than what we normally want on these mandibular anteriors especially. You want to make sure that your patient, instruct them to close slowly and bite. We don't need a patient biting down as fast and as hard as they can. I always tell patients, you're not going to get any kind of award or discount for that. So make sure they slowly close down, bite together, and, especially in this anterior region, if your patient is having some discomfort, you can always utilize a cotton roll placed in between the bite block and the opposite teeth to help with some comfort and stability. So, of course, have your patient breathe, ask the patient, make sure that they are gently biting down. It gives them something to concentrate on other than the radiograph that you're about to take. Make sure once you're in place, you're happy with everything. You position your tube head parallel to the ring. Go ahead and make your exposure. So we hope that helps a little bit. Certainly, if you have any suggestions, don't forget to like and subscribe. You'll see more of our training videos as well. And of course, we do appreciate the support.